In anterior cruciate ligament reconstructions with hamstring autograft, which is a graft that you take from the patient, we had new literature in 2015 which displayed a greater risk of failure for smaller grafts, which is a problem. There was a failure rate of upwards of 30%. As a surgeon that performs ACL reconstructions, my goal was to try to find a better way using a graft that is commonly used, which is hamstrings. Most people take the two tendons, the semitendinosus and the gracilis, and you loop them over through a special device, and it's called a four-stranded graft. With that graft, we measure the graft size, and you're really trying to get to a objective tendon size to get past that threshold for a failure rate. And in smaller individuals, it can become difficult because the tendons are smaller. And so really my goal was to figure out a way to make that graft bigger. One day it just came to me, looking at the graft, and there's the sartorius tendon, which is one of the three tendons we use. Before, we would just use the semitendinosus and the gracilis, and the sartorius would just kind of get pushed to the side or even cut out. And so what I noticed was this was really a substantial tendon that could make a difference. And so when this idea came to me, and these ideas came to me, in private practice, it's not exactly easy to do research. Research is typically driven out of an academic institution. I called Dr. Bill Sherman, and he has a fantastic research program at Tulane Orthopedics. He loved it. We got together and we brainstormed about ideas. We used my patient data, but then we also did lab work together down at Tulane, where we spent a weekend together harvesting hamstring tendons and running them through mechanical testing. The first time we did it, we noticed it increased the graft size substantially. And so with a five-stranded graft, it really put us over that threshold 100% of the time. This typical procedure we've been doing for about 7 years. What we've seen is a significantly less failure rate in those patients that would be at risk for a smaller graft. We just presented this paper at the Louisiana Orthopedic Association and had excellent feedback. Several doctors have contacted me about technique and how we utilize it, and so it was very well received. When you're talking a 30% failure rate in a published study in 2015, our failure rate is much less than that. And decreasing a significant failure rate in an at-risk population is always going to benefit the patient. They might not realize it because it's not that orthopedic research makes it to the front page of the paper, but as orthopedic surgeons, we recognize that this has gone a long way, at least in my practice, and hopefully soon in other practices, to really reduce the risk of ACL reconstruction failure.